What happens if you squeeze a soft ball every day after 60? Here's what most people get wrong. They think it is a tiny hand exercise for stiff fingers. It is not. In many older adults, that little squeeze is really a signal about blood pressure, balance, brain health, and whether your body is holding on to strength or quietly giving it away. One number I want you to remember is 16%. Because in a major international study, every drop of just 5 kilograms in grip strength was linked to a 16% higher risk of death from any cause. That is not a small number, and the everyday habit that feels harmless is this: going long stretches without ever truly challenging your hands to grip, press, and hold. Now, this is not really about a ball. It is about whether you can open a jar without pain, whether you can carry your own groceries, whether you can catch yourself when you trip on a rug, whether your blood vessels stay flexible or start behaving like old garden hoses, whether your brain keeps talking clearly to your muscles. People wait until a hand feels weak, a shoulder feels shaky, or a fall scares them. By then, the body has usually been sending quiet warnings for years. Loss of grip is often one of those warnings. It looks small. It is not small. It can be the first loose thread in a much bigger fabric. My name is Dr. David Reynolds. I have spent more than 15 years caring for older adults, reading the research, and helping patients protect the things that matter most: mobility, memory, blood pressure, confidence, and independence. I'm not here to sell you a supplement or scare you into a course. I'm here because too many people are never told that something as simple as daily hand grip work can become a practical doorway into better aging when it is used the right way. And stay with me until the end. Because one of the most surprising effects has nothing to do with your hands at all. It has to do with your brain. Most people never see that connection coming. And before we go further, tell me your age in the comments. Or tell me the number of times per week you currently do any kind of strength exercise. I read every single comment. And those numbers help me understand who I'm speaking to and what you need most. Before we get to the list, I want to give you a simple map. There are 3 core mechanisms you should keep in mind. First, muscle signaling. When you squeeze and hold, your muscles are not just moving. They are sending chemical messages throughout the body. Think of muscle like a pharmacy you carry around with you. When it is active, it releases helpful signals that support blood sugar control, circulation, and resilience. Second, vessel training. A steady squeeze briefly changes pressure inside the arm, and when you relax, blood rushes back through the vessels. Think of your bloodstream like a river delivery system. That squeeze and release acts like opening and closing a gate in the river. Over time, that can train the vessel walls to respond better. Third, nerve wiring. Your brain has to recruit muscle fibers, coordinate your fingers, and judge force. Think of your nervous system like the wiring in a house. If certain circuits are never used, they do not stay sharp. Daily gripping is a simple way to keep some of those circuits online. Those 3 ideas, muscle signaling, vessel training, and nerve wiring, are going to come back again and again. Number 1, it trains the strength that protects daily independence. Here's what it does inside you. When you squeeze a soft ball, you are waking up the flexor muscles in the hand and forearm. But you are also training your brain to recruit force on purpose. Think of your grip like the handshake between your brain and your body. A weak handshake means the message is getting soft. A stronger one means the system is still responsive. A major study, called the PURE study, looked at 139,691 adults across 17 countries. Researchers found that every 5 kilogram drop in grip strength was linked to a 16% higher risk of death from any cause and a 17% higher risk of death from cardiovascular disease. The authors even reported that grip strength predicted these outcomes better than systolic blood pressure. That is not a small number. So what should you do instead? Use a soft ball once or twice a day. Start with one hand. Squeeze to about a moderate effort, not an all-out crush, for 5 seconds. Then relax for 5 seconds. Do 10 repetitions per hand. Rest. Then repeat one more round. If you have arthritis, use a softer ball and shorten the hold to 3 seconds at first. The goal is not pain. The goal is consistent signal. Let me tell you about someone I'll call Maria, 72 years old, from Phoenix. She told me the first sign of aging that truly upset her was not gray hair, not knee pain. It was dropping a ceramic coffee mug she had used for 20 years. She said the sound of it shattering on her kitchen tile made her feel older than any birthday ever had. We started a tiny routine, daily softball squeezes, simple carry exercises with grocery bags, and standing from a chair without using her hands. 8 weeks later, what changed first was not a lab test. It was her confidence. She noticed she could twist the cap off a water bottle without bracing it against the counter. That is the benefit. Not just stronger hands, better function in real life. Synergy tip. Pair your ball squeezes with a daily carry. After your hand routine, carry 2 light grocery bags around your kitchen for 30 to 60 seconds. That teaches the grip you build to show up in the world you actually live in. Number 2, it can help lower blood pressure. When you do it the right way. Now here's the part that should concern you most. Many people think blood pressure only responds to walking, medication, or cutting back on salt. Those matter. But here's what most people get wrong. Certain forms of simple isometric exercise, meaning muscle work without a lot of movement, can also help. Here's what it does inside you. A sustained squeeze puts controlled tension on the muscles and vessels of the arm. Then, when you release, blood flow surges back. Think of your arteries like a garden hose that has become a little stiff over the years. Repeated, safe pressure changes can help the hose stay more responsive. That is vessel training. A 2021 systematic review and meta-analysis in hypertension research pooled 24 randomized trials with 1,286 participants. It found that isometric hand grip exercise lowered office systolic blood pressure by an average of 6.45 millimeters of mercury. And in adults, aged 65 and older, the reduction was 7.17 millimeters of mercury. In blood pressure care, that is meaningful, there was also a randomized trial from Nippon Sports Science University in Japan involving 22 middle-aged and older adults, average age 65. After 8 weeks of hand grip training, the exercise group had significant reductions in central and arm blood pressure compared with the control group. So what should you do instead? If your doctor has not told you to avoid isometric exercise, try this protocol 3 to 5 days per week. Squeeze the ball and hold at about 1/3 of your maximum effort for 2 minutes. Then rest for 1 minute. Do that 4 times. alternating hands if needed. That is longer and gentler than most people expect. The mistake is squeezing too hard. This is not a strength contest. It is a blood vessel training session. If you have uncontrolled high blood pressure, chest pain, recent eye surgery, severe hand pain, or you hold your breath when you strain, talk with your own clinician first. Never clamp down and bear down. Breathe normally. Let me tell you about Harold, 68, from Tampa. He was doing what he called angry squeezing. Those were his words. He would grab a hard gripper, clench his jaw, turn red, and hold his breath. My first reaction wasn't fear. It was frustration, because nobody had explained the difference between training and straining. We switched him to a softer ball, gentler holds, calm breathing, and evening walks after dinner. 3 months later, his home readings were steadier, and just as important, the routine felt sustainable. That is the real win, a small ritual you can actually keep. Synergy tip: do your blood pressure squeezes after a 10-minute walk, not before bed if they energize you. Walking opens the vascular system. The hand grip work reinforces it. Number 3, it can ease stiff, aging hands and help you use them more. If you are over 60, hand stiffness is not a side issue. It changes everything. Here's what it does inside you. Gentle squeezing nourishes movement in the small joints, wakes up the muscles that support the thumb and fingers, and improves circulation to tissues that often get neglected. Think of a stiff joint like a rusty hinge. You do not fix it by slamming it open. You fix it by moving it often, carefully, and with control. A Cochrane-style review in the medical literature looked at 7 randomized trials involving 534 people with hand osteoarthritis. The review found that exercise led to a 5% absolute reduction in hand pain and a 6% improvement in hand function compared with control groups. Several of the exercise programs specifically included rubber ball squeezing. Now 5% may sound small on paper, but if that 5% means you can button a shirt more easily, write a grocery list without stopping, or hold a panhandle with less hesitation, it matters. So what should you do instead? Warm the hands first. Run them under warm water for 1 minute, or wrap them in a warm towel. Then do 8 to 12 gentle squeezes with a soft ball. Hold each one for 3 seconds and release slowly. After that, open the hand wide like you are spreading your fingers across a table. Repeat that open and close pattern twice. Do it once in the morning and once in the late afternoon if stiffness is your main issue. Let me tell you about Evelyn, 76 years old, from Columbus. She loved to bake, and the smell of cinnamon in her kitchen was one of the details her grandchildren always remembered. But she had reached the point where gripping a mixing spoon hurt. She thought rest was the answer. So she stopped using her hands as much as possible. That backfired. Once we added warmth, ball squeezes, thumb stretches, and lighter utensils, she was back in the kitchen. Not because the pain vanished overnight, because the hands stopped acting frightened of movement. Here's what most people get wrong. Sore hands often need smarter use, not total withdrawal from use. Synergy tip: pair hand squeezes with warm water, and then a few minutes of food prep, folding towels, or another real task. The exercise teaches the joint. The task teaches the life. Number 4, it may protect your brain more than you realize. Stay with me until the end, because this is where the story gets bigger. Here's what it does inside you. Every squeeze is a command from the brain to the body. Force has to be planned, coordinated, and adjusted. The brain does not simply shout, "Close the hand." It measures position, pressure, speed, and fatigue. Think of grip like a live phone call between your brain and your muscles. If the line gets staticky, both ends suffer. A large UK biobank study, published in JAMA Network Open, evaluated 190,406 adults. Researchers found that for every 5 kilogram decrease in hand grip strength, the hazard of all-cause dementia rose by 16% in men and 14% in women. The authors concluded that hand grip strength was tied to neurocognitive brain health and may reflect the health of the brain's vascular system, the small blood vessels that help keep brain tissue alive and functioning. Now, I want to be very clear. Squeezing a soft ball is not a cure for dementia. It is not a magic shield, but it is one simple way to train and monitor a system that is clearly connected to brain aging. So what should you do instead? Use the ball as part of a brain and body pair. While you squeeze, count backward from 20 by ones, or name animals, or alternate right hand and left hand while saying the months of the year. That turns a hand drill into a coordination drill. 10 to 20 alternating squeezes is enough. Let me tell you about someone I'll call Thomas, a 71, from Des Moines. He came in because he felt slower. That was his word. Not confused. Slower, his wife noticed he would pause before fastening buttons or sorting pills. We added a very small routine, alternating hand squeezes while he named grandchildren, fruits, or cities. At first, he laughed at how simple it looked. Then he admitted something important. It made him feel sharper, more connected, less passive. That matters. The brain needs demand. So far we've covered hands, blood vessels, joints, and now the brain. You can see the pattern. The body does not age in isolated compartments. Synergy tip. Pair your squeezing with a short walk outdoors afterward. Hand grip work activates the system. Walking gives the brain blood flow, rhythm, and sensory input. And if this is helping you, subscribe and share this with one person you love. That is not for vanity. It is because most doctor visits are too short to cover the daily habits that actually shape aging between appointments. If you have a parent, spouse, neighbor, or friend over 60, sending them. This may help them protect years of independence. Number 5, it can support balance and lower your risk of a serious fall. A lot of people hear grip strength and think hands only. That is the mistake. Here's what it does inside you. Grip strength is often a window into total body reserve. Think of it like the check engine light on a car dashboard. The light is small, but it may be telling you something about the whole machine. A body that has enough strength to grip well often has better reserve in the legs, trunk, reaction speed, and recovery. A +1 analysis from the ASPREE group followed 16,445 older adults, mostly age 70 and above, in Australia, and 65 and above in the United States. Over about 4 years, each standard deviation drop in grip strength was linked to a 27% higher risk of serious falls. 27%, that is not a small number. Why would your hand predict your fall risk? Because the same aging processes that reduce force in the hand often reduce force everywhere else. Lower muscle quality, slower nerve firing, less reserve, less confidence. So what should you do instead? Use squeezing as a doorway, not the whole program. Do your ball routine. Then immediately practice 5 sit-to-stands from a sturdy chair. If that is easy, do 10. If you are safe to do so, stand near a counter and practice holding balance on one foot for 10 seconds each side. Your hand work becomes the opening act. Your leg and balance work become the main event. Let me tell you about Darnell, 74, from St. Louis. He told me the scariest part of his fall was not the bruised hip. It was the silence afterward, lying on the hallway floor, hearing the hum of the air vent, and realizing nobody knew he was down. We started small, because he was scared. Softball squeezes, chair rises, counter-supported balance. Nothing flashy. 3 months later, he said, "I don't feel fragile when I turn around anymore." That sentence stayed with me. Here's the part that should concern you most. Once people begin to feel fragile, they move less. When they move less, they get weaker. That is how a fall becomes a downward spiral. Synergy tip. After every hand session, do at least one lower body move. Always. Teach the body that strength is a full body language. Number 6. It reminds your body to hold on to strength instead of surrendering it. This last point is the deepest one. Here's what it does inside you. Daily squeezing is not just exercise. It is a message. Use this tissue. Keep this wiring. Maintain this reserve. Think of aging muscle like a savings account. If you never make deposits, time keeps making withdrawals. The Pure study again gives us an important warning. In that international sample of 139,691 adults, lower grip strength was linked not only to all-cause mortality, but also to cardiovascular mortality and disease events. In plain language, when grip falls, it often means the body is losing reserve in ways that matter across the entire system. And the dementia study tells the same story from another angle. Weaker grip, tracked with poorer long-term brain outcomes in a sample of more than 190,000 adults. Different study, same message. Grip is not just about opening jaws. It is about physiological reserve. So what should you do instead? Create a nightly 2-minute ritual. Put the soft ball in the chair where you watch television, or beside your toothbrush, or near the kettle if you make tea. Anchor it to a habit you already have. 10 squeezes each hand. Calm breathing. Tall posture. Then ask yourself one question. What other strength signal did I send my body today? Maybe it was a walk. Maybe it was stairs. Maybe it was carrying laundry. Maybe it was getting up from the floor. Let me tell you about Ruth, 80 years old, from Boise. She lived alone, and that fact made her proud. Not defensive, proud. When winter came, she noticed she was using both hands to lift even a light saucepan. She told me, very quietly, "I can feel myself becoming careful." Those words hit me, because careful can be wise, but sometimes careful is really fear. Wearing polite clothes. We built a routine around tiny strength deposits, hand squeezes, wall push-ups, standing from a chair, and carrying one small bag of canned soup from one counter to another. Months later, she said, "I still live alone, but I don't live timidly." That is the benefit. Not perfection, not youth, capacity. Let's bring it all together. Number 1, squeezing a softball trains grip, and grip is a major marker of independence. Think of it like the handshake between brain and body. Number 2, when done as a calm isometric hold, it can help train your blood vessels and support healthier blood pressure. Think of your arteries like a hose that needs to stay responsive, not brittle. Number 3, for stiff or aching hands. Gentle squeezing can improve circulation, support the joints, and help reduce pain and improve function. Think of a rusty hinge that needs careful motion, not neglect. Number 4, grip strength is tied to brain health. Think of each squeeze like a phone call between your nervous system and your muscles. You want that line clear. Number 5, better grip often reflects better whole body reserve, and lower grip has been linked with higher fall risk. Think of grip like a dashboard warning light for the rest of the machine. Number 6, the daily squeeze is a message to aging tissue. Stay online, stay useful, stay ready. Think of muscle like a savings account. Small deposits matter. That is why I care about this so much. Not because a foam ball is magical, because a tiny daily act can become a gateway to bigger protection. Here is your simple plan for tonight and this week. 1. Tonight, find a soft ball, rolled up sock, or gentle hand exerciser that does not cause pain. 2. Do 1 round of 10 squeezes per hand, holding each squeeze for 3 to 5 seconds. Breathing normally. 3. If your goal is blood pressure support, on 3 to 5 days this week, do 4 longer holds of about 2 minutes at a light to moderate effort with 1 minute of rest. 4. After every hand session, add 1 full body move, 5 to 10 chair stands, or a short walk, or a simple carry. 5. If your hands are stiff, warm them first for 1 minute. 6. Once this week, pair squeezing with a brain task. Count backward, name animals, or say the months out loud. 7. Keep the ball where you will actually see it. What gets seen gets done. So what should you do instead of waiting for weakness to show up? Send your body a signal today. I want to end here. Healthy aging is not about winning some contest against time. It is about dignity. It is about reaching into the cabinet without hesitation, carrying your own groceries to the car, steadying yourself when the sidewalk is uneven, remembering a grandchild's name quickly enough to see that smile in their eyes, sitting at dinner, laughing hard, and not feeling like your body is leaving you behind. I have seen people in their 60s, 70s, and 80s make meaningful changes from very small beginnings. A soft ball, a chair, a countertop, a daily promise kept. That is why I never dismiss simple habits. Simple is often what people will actually do, and what you actually do consistently changes more than what you intend. If nobody has told you this lately, let me tell you now. Weakness is not always destiny. Stiffness is not always surrender. Slowing down does not mean giving up. With the right signals, the body can respond. Maybe not perfectly, maybe not overnight, but it can respond. It is never too late. If this helped you, subscribe and turn on the notification bell so you do not miss the next video. And in the comments, tell me this. What is one daily task you want to keep doing on your own for as long as possible? Opening jars? Carrying groceries? Gardening? Cooking? Walking upstairs? Writing by hand? I want to know. I read every single comment.